My rotation in Thailand was by far the highlight of my medical school experience. Prior to this, I hadn't had the opportunity to really have global health experience. So for me, knowing that in the future I want to practice in other countries and other parts of the world, this really set the foundation for me. And I'm really, really incredibly grateful for UCLA and all of the faculty who made this possible.
I think my experience doing a global health trip through UCLA to Mozambique will absolutely shape how I practice as a physician in the future. For one thing, it showed me ways that I can incorporate global health into my career, whether that be through building partnerships or even just doing the equivalent of global health work with underserved populations more locally. I really look forward to seeing where things go in the future, and I know my experience in Mozambique will shape that.
I was actually raised up in Hangzhou, China. So this is an extremely personally meaningful opportunity for me because I used to receive care growing up as a teenager, as a child at that hospital where I have the opportunity to rotate at.
In Somerset, you'll see patients that you might not see in the US. Like we saw, at least I took care of a lot of patients with HIV, AIDS, and the complications and sequelae of having AIDS, as well as tuberculosis, as well as the other common diseases, the heart diseases, kidney diseases that we see in the US. As a future physician, my goal is to work with underserved populations. So being able to be in that setting and learn more about conditions that I most likely wouldn't see in the US to that extent was really a great experience for me. Really, again, a life-changing, life-altering experience.
I would highly encourage anyone to get involved in the global health pathway at UCLA since the beginning, if they can. I was lucky enough to get involved my very first year and to have stayed involved for 5 years now, including an extra year to do a research fellowship. And I think that experience with the GHP and with global health in both research settings and now clinical settings has been integral to me setting some of my future career goals and knowing that I want to make global health an integral part of my future career.
So I did a 2-part rotation. The first week was in traditional Thai medicine, where we learned a little bit about traditional Thai culture and working in the integrated medicine clinic. The last 2 weeks of the rotation were in the ophthalmology department, where I was able to rotate through various ophthalmic subspecialties, including glaucoma, cornea, retina, oculoplastics, and even had the opportunity to go into the OR as well.
I think the global health opportunity was an incredible experience that any medical student can benefit from training at another hospital, from seeing another system, and especially if that system is out of the United States. And I think it makes you, one, have a lot of perspective and gratitude for what we do have just at our fingertips here, especially at UCLA, but at many hospitals in the US. And it was just a life-changing experience with connections that I hope to uphold throughout the future.
The Global Health Department here was a major reason for me choosing DGSOM as a place to study, and so the opportunity to end my medical career on a global health elective is just more than I could have asked for. So just very thankful for everyone here and the support of the Global Health Department.